Hi, my name is Brenda Luther. I'm an associate professor at the College of Nursing. I'm here to present a poster about a project we've had going at the college about 4 years now, and that is bringing primary care nursing content to our baccalaureate curriculum courses. This is my whole poster, but as soon as I can get my cursor over there, I will share, I'll break this down. And I think I'll minimize my picture here for you. So this is a NEPQR grant. That's an Education Practice Quality Retention, a HRSA grant. And its purpose is to develop academic clinical partnerships with urban and rural underserved clinics. We work mostly with federally qualified healthcare clinics in our state and locally. This is a HRSA grant, and this is the HRSA disclosure for you. The purpose of our grant, well, the need for baccalaureate preparation in primary care is great. It's been called out by national and international organizations for a while, like the Mason Report, Robert Wood Johnson, the future of nursing. But with RNs being the largest healthcare workforce, meeting value-driven outcomes for our patients requires the full complement of a team to be working with the top of their licensure. So what does that mean, and how do we do it? Well, we also know the need is rural and underserved populations have disproportionate poor healthcare outcomes. And we know that the presence of an RN can positively affect those outcomes. We also know that our patients need improved access to care, and that we know a team also helps develop positivity in care. And I'll explain a bit about that later. The undertaking has been to enhance our curriculum, not duplicate it across our baccalaureate tracks. We identified rural and urban clinical sites where nurses are working to some of these enhanced roles. We also undertook to provide this continuing education to existing primary care nurses in the communities. And we also have helped identify billable RN services in primary care, really making the financial case for hiring RNs. We're using digital badges to incentivize student engagement in this content in modules. We use concepts of gaming to increase interest and motivation. And we also undertook helping our baccalaureate faculty become more aware of the full complement of primary care RN competencies. So what is the top of the licensure? We all say and talk this. I like this quote from Russell David and Messer, matching the right care provider to the right skill at the right place and time. And that includes nurses in that work. I did a small reference to the quadruple aim. It used to be the triple aim, with improving outcomes, improving patient experience, and lowering costs. Nurses help promote all three of those aims. The fourth aim, improving the provider experience, is also really important. Primary care has a large burden of producing the value-driven outcomes that we need, and they need a full complement of the team to do that. And here's where the RN can play a part of improving the provider and the team's experience in value-driven outcomes. With the nurse working to the full extent of the licensure, it takes some of the burden of chronic illness management, of wellness screenings, of a few other skills I'll tell you about as we go forward here. So we produce digital badges. The badges are on the left. There's 6 badges. The content of the badges is on the right. There's 13 pieces of content. And these are certainly a part of baccalaureate curriculum now, but typically seen in a very acute care setting, not applied in primary care. So we applied all these in primary care and developed these badges and modules. So once the students finish the modules, which are interspersed through their program of study, they're awarded a badge. They're not necessarily awarded a badge after one course. They maybe had a piece or a part in another course. So they watch over the program of study as they attain these badges. What is a digital badge? It's an electronic representation of learning objectives, specific sets of competencies, and clinical experiences. It highlights this work, excuse me, my picture's over that. It highlights this work both to the student and the employer Nurses in primary care are few and far between, as we've discovered. And so a way to promote that the student has attained these skills was important for us to do for the student's future employers and for the student themselves. Our challenges were to enhance, not duplicate content. In this way, we felt like we did not add to a burden of a baccalaureate nursing education. We added to describing the roles and responsibilities and skills and competencies. Another challenge was finding robust clinical sites. We had a hard time finding nurses working to the top of their licensure, but we did so more often in rural and underserved clinics, and I think I know why. Because there's so few people there, they all shared and recognized what the full team could do, and didn't have. They were glad to have nurses in the clinics where they were working. We found also a challenge in this for other schools who are NEPQR grantees, in that they had to flip to online content with COVID. So we shared these modules with 24 other schools and colleges across the country. We've also found a continuing challenge for our students to be able to get to these clinical sites, for we ask them to do 150 hours in primary care, and that is a challenge for them. Nursing students usually work, they have families, just like most of our baccalaureate students at our university do. So heavily scholarshiping them and paying for their lodging and travel is really important to the grant to be able to do to promote these competencies. Our initial successes that were almost 2,000 badges have been completed, over 2,000. I think we're up to 2,500 this semester. We've awarded 700 digital badges. Another success was that RNs in these sites stepped up for specialized preceptor training over a month of time, because they were less often having students fully engaged in work, mostly observing work. Now students were doing the work of RNs. These RNs in our rural and underserved areas are champions of the program. We also had some successes in statewide webinars where we're focusing on what are the billable services. We have students and RNs in these. The typical webinars: annual wellness visits, advanced care planning, transitional care, chronic care management. And these three things have been common RN-led activities in team-based care for a while in pieces and parts of clinics across our state. We're also developing RN-led protocol-driven care, wherein the interprofessional team writes a protocol and the nurse administers medication, opioid use disorder programs, dementia care, women's health screening, family planning. So here's my whole slide again. Please feel free to contact me. And thank you for coming to this webinar.